guy called Treflyn and Lloyd, and he's speaking as the General Secretary of ISAAC, the International Substance Abuse and Addictions Coalition. We first met at Yeldon Manor when I was working in referrals, and he came after university to do, it wasn't a gap year, it was just kind of do a year of volunteering and see where you go from there. And during that time we started a record company called Unreal Records. It was really his venture, it was my dissatisfaction at his guitar aspirations, which we're going to see later on because he's a very good guitar player, and I'm going to tap along on that box over there. But he's going to tell you about ISAAC, he's going to tell you a bit about himself. They've got contacts in many other countries. We think sometimes we get caught up with ourselves here and recovery in this country, and whether or not there's funding, or whether or not there's this, or whether or not there's that. Tref works in some places where they grow their own food, and the state has no response to addiction other than an often very negative and difficult one. Never mind addiction solutions that have got maybe a Christian or a spiritual element to them. And harm reduction, that again is another story. So he's going to tell you a little bit about his work.
It's a real privilege to be here, and it's great to see so many people coming here for this day. Hussein and I've talked about this over the years, even before it started, and to see the reality of this conference, to hear about the reality of the Towards Recovery Cafe is just brilliant. It's a real privilege to work with Hussein over the years. He's an ideas man. It was our desks were at right angles to each other, and it was 10 ideas a day. but some absolutely brilliant things like today, like the Recovery Cafe. So it's just thrilling to see it as a reality. As Hussein has mentioned, I am blessed to be involved in this network around the world. We have members in over 70 countries, and recovery communities are happening in every corner of the world. I just wanted to start with just some of the places that I've been privileged to go to be in the countryside in Mongolia at a recovery meeting. The road to this town was different tracks across a field, and it's the provincial capital, but there recovery is happening in a place where 51% of the population has a serious alcohol problem. And yet recovery is happening. A rehab in Tajikistan, just not far at all from the Afghan border. The joke in Dushanbe, the capital of Tajikistan, is not how many dollars is your car, it's how many kilos is your car. That's how the economy works. You could buy, this was maybe 10 years ago, you could buy a kilo of heroin for $1,000 and sell it in Moscow for $20,000. A doctor was paid $10 a month. It's difficult places, and yet there's a rehab there. It's happening. Street work in Kazakhstan, the alleys in Almaty, where people are going out and doing, building the relationships. I heard the story of one of the ladies I met there in, I think it's 2010. They've been working with her for 5 years, just meeting her, helping her get the help that she can. She was still using. They were doing the needle exchange and the syringe exchange there. I heard last year that she got free. They worked 5 years. They'd meet her several times a week in this alleyway, help her with her child and things, and it took that 5 years of relationship before she got freedom. Just the last place I'd like to mention is this second stage program that I've been to in a lovely Russian town called Asbest. You can guess what they mine there. It's the world's largest open cast asbestos mine. So you go and visit and they say, oh, come and see the mine. The second time I went, my wife said, don't breathe while you're there. But that's the reality. Even in all these places that feel like the ends of the earth, recovery is happening. Now, as I said, this network is a network of Christians doing this work in all these parts of the world. Some of them are doing them through churches, some of them are doing them on their own with a bit of support or in rehab centres, etc. But it's fantastic to see the creativity and the diversity that's happening in all different parts of the world, things that we maybe wouldn't even think of here. And part of my role, we say in Isaac we do three things. We connect, we encourage, and we equip. And a lot of that is gossiping about things that I've seen, saying to people, do you know, I saw them do this over here, maybe that would work, or come and let's go and see something else. And that sharing of techniques of understanding, like I said, the creativity to be inspired to do something new or in a new way, or even to take some of the best practice that is already established and see that implemented in other places. For many years, I think that those examples I said, you can see there's a bit of a Russian focus. I was involved in trying to get HIV on the agenda for a lot of the rehab centres in Russia, where they were doing great work with the addiction work, they were doing great work with the recovery, but had kind of thought of anything to do with HIV as a medical issue that they didn't need to think of, and yet most of the people coming through their programs were living with HIV. Most of the staff had grown up through the programs were also living with HIV. So we were able to do a program and through the relationships that we had built to get other people who had lived through that in other parts of the world to share their experience, and very quickly those good practices, good understandings became embedded, so now they are training people in other parts of the world. So, as I say, connect, encourage and equip, that's basically what we try and do. And also to say that maybe 2/3 of our members, we have hundreds of members all over the place, maybe 2/3 are on recovery journeys themselves. So it's part of this sort of social networks that you talk about, even people who are now working in this area. They need that support to carry on. Some people working with very few finances, very little support or understanding of what they're doing. And to have that network to continue to do the work is absolutely vital. I've just come back from a conference in Asia. We had one in Phnom Penh. One of the main focuses was on recovery from trauma. So to be doing that in a building overlooking the Genocide Museum, the school that they turned into a prison in the centre of the city where a lot of the torture happened was really sobering. And to be doing it in a country that has first-hand experience of so much trauma, and yet to be talking about recovery, about healing, about moving forward was a very special time. We had more than 20 countries represented there. Although it was an Asia conference, we had 6 continents represented there because people love the fellowship and the sharing of experience and want to see what they can learn from each other. We haven't yet got any members in Antarctica, so just seeing if I can tick off all 7 at some point. Just also to say a bit about what's happening in the UK, we are trying to get some of these regional meetings happening quite well in London and the southeast, and in the north there's actually a guy who was a graduate of the Lee community who is wanting to get something happening in West Wales. He runs a project there. I'll be in Scotland soon to again get some things happening on a more local basis. We've tried to do things nationally, but actually if the relationships are important, then it needs to be real relationships, and I find that we can do that more effectively in smaller areas. And I'd say that there are, with what we're trying to do in the UK, there are like the 2 rails of the train track. So there's the community and the relationships that we can help to happen, and there's also the side of advocacy and policy. There are some within the network who are passionate about those areas, but for the 2 to work together, they need to be going in parallel. Hussein mentioned one of my key things about this idea of gift economy. Everybody wants to give. How can we create that space so people can give the best of what they have, rather than see themselves in competition with each other or trying to see what they can take, but saying, this is what we have. We'd be keen to use that to see the whole recovery communities all get better and move on and be more effective. And that's something that I'm very keen to foster within Isaac. Can I just do a very quick example of some of the practicalities of how that happens? I was in Estonia in August, a centre there called Village of Hope. They've been members of the network for a while. It was the first time I'd had a chance to visit them. And there were things about their model that just blew me away. They used a Swedish design of houses with 8 to 16 people in there, so if they want to expand the rehab, they just build another house, chop down some trees and build another house. So a model that is so easily scalable. But they said they had 4 needs, 4 very specific needs, and how could maybe the network help. One of them was that they only at the moment are able to help men. And they had a woman that was doing something that really needed help. And there wasn't anywhere in their country for her to go to. So through the network, we could find some other centres in other parts of the world who would be welcoming of her coming and doing her rehab there. So something very practical. And actually through that relationship, they're hoping to start a women's centre. They have the building, but to get the understanding and to expand their work there. So that was one. Second was in aftercare. Again, they have a building, they have one of the guys who's been through the programme, who's passionate about doing aftercare. And they said, we're still renovating the building. Is there anywhere that he could go to learn a bit of the skills? And I thought of one place in the north of the UK, and some of you guys have been up to visit it, and I emailed this guy. And it's a big ask, you know, somebody you've never met before, from a different country. I'm asking, maybe spend a couple of months with you to learn what it is. It took him 7 minutes to respond, saying yes. You know, let's talk about the details, but yes, he can come. And that's the gift economy at work. Somebody willing to make room for somebody else who they don't necessarily know, but to see their programme grow. The third area was their orientation phase. They hadn't done so much work when somebody first comes to the programme, and as we know from the discussions this morning, that is culture shock. And they were saying, we know we need to do some work on that. And I was blessed that Yelda were willing to share the work that they had done on the orientation phase just a few months earlier, and share that again with the centre that they don't particularly know. And also as an area of accreditation, being part of the European Union, they now need to have pieces of paper. These are people with great experience, great personal experience of recovery, but they now need the piece of paper so we could link them with other people within the network who could help them get the accredited training that they need. Final point is, I think I'm just about in time, about the creativity and the diversity. This is the first rehab centre I've ever been to that has its own fire department. They live in wooden houses in the middle of the forest, and they had a minor fire, and they realised how far away the fire station was, and so they through some church connections in Sweden, they managed to get a Volvo fire truck, and now they are an accredited volunteer fire department of the Estonian National. And the guy said to me that when we first moved here, there was a petition of all the people who didn't want a drug rehab there. He said now we would get 10 times as many signatures of people who wouldn't want us closed down because of that attitude of how can we serve our community, how can we be creative in doing that. So anyway, sorry, lots of random stories, but thank you for being here, thank you for listening.